Hello, my name is Jennifer Vargas, and today I will be discussing epidemiology and control of HIV/AIDS in Guatemala. So, a little bit more about Guatemala's background. Guatemala is a developing upper middle income country with a population of about 70 million. One of the current challenges that Guatemala is facing is poverty, and according to the World Bank, poverty and inequality rates are at the highest in all of Latin America and the Caribbean region. Additionally, a large amount of the rural and indigenous communities in Guatemala are underserved, and they do lack access to adequate health care. The background of the HIV/AIDS outbreak in Guatemala in 1984, the first case of HIV was reported from a 28-year-old man who was visiting from the United States. The first two cases of AIDS in women specifically were reported in 1986. Both of these women had just traveled from the US and they were both infected through blood transfusion. However, the first Guatemalan cases of HIV/AIDS was in 1988, where two Guatemalan residents were reported to have been infected with the virus. The first resident was a 12-year-old girl who had contracted the virus through a blood transfusion, and the second was a 38-year-old homosexual man. Some methods of surveillance in regards to Guatemala's current epidemic issue. Guatemala did not have sentinel surveillance until 1998, according to USAID, and they currently do not have a national surveillance system. However, the U.S. President Emergency Plan for AIDS Relief, known as PEPFAR, was launched in 2003 to help countries such as Guatemala in implementing HIV case-based surveillance implementation. Additionally, the CDC Central American Regional Office has worked with the Ministries of Health of Guatemala since 2003 to help strengthen their disease surveillance systems. Some epidemiology. So less than 1% of the adult population in Guatemala is HIV positive. Most of the HIV/AIDS cases are concentrated primarily in urban areas such as Guatemala City. As of 2016, 70% of the population living with HIV/AIDS lived in Guatemala City. And in 2021, according to UNAIDS, 31,000 adults and children were living with HIV, and about 1,200 were newly infected adults and children were living with HIV. The prevalence in 2021 for HIV was 0.2%, and the incidence was reported to be 0.09%. And the estimated AIDS-related deaths for both adults and children was less than 1,000. Moving on to more epidemiology. In regards to the most vulnerable populations in Guatemala that are most at risk for HIV/AIDS, this includes commercial sex workers, men who have sex with men, tuberculosis patients, and prison populations. As of 2021, the prevalence among sex workers was 1%, and it was 9% for men who have sex with men. However, the prevalence for both men and women was less than 0.1%, according to UNAIDS, and in 2021, the mortality rates for both men and women was less than 500. As a side note, and we'll discuss this more later, transmission rates among indigenous populations in Guatemala was 3 times higher in comparison to their non-indigenous counterparts. Here's a graph showing the number of new HIV infections in Guatemala between the years 1990 and 2020. As you can see, since 2000, the rates have been decreasing significantly, and it has been less than 1,000 from 2010 onwards. Here's another graph showing the number of AIDS-related deaths in Guatemala between the years 1990 and 2020. So the mortality rate for AIDS-related deaths has declined from 24,000 from 2003 to 2020, where now it's less than 1,000 deaths. So some preventative measures that Guatemala has been taking. As I mentioned before, the U.S. President's Emergency Plan for AIDS Relief, PEPFAR, has helped support Guatemala in hopefully achieving UNAIDS 95-95-95 HIV treatment targets. This goal is basically saying that the goal is for 95% of people living with HIV will know their status. 95% of people who will have sustained art therapy, and 95% of people with art therapy will have viral suppression. Additionally, PEPFAR has provided support and funding for HIV/AIDS treatment, prevention, and care programs, especially for the most at-risk populations. And the CDC Central American Regional Office has worked with the Ministries of Health of Guatemala to help implement STI surveillance, prevention, and control strategies. One of these control strategies is known as VICTUS, and VICTUS is a program that was designed to help tailor HIV prevention and testing to the most at-risk populations. Some barriers that Guatemalan populations face right now in regards to rural and indigenous populations. These are the most disproportionately affected by HIV. They do have limited access to basic health services, and because of that, they have lack access to HIV prevention and care services. Because of the location of where they live, they do lack HIV and STD clinics in their areas, which ultimately leaves them more vulnerable to the virus, and they have limited access to HIV testing and screening. Additionally, transgender population is also listed as one of the most vulnerable populations in Guatemala. They do face heavy exclusion, discrimination, and stigma. And because of this, they are severely marginalized and they have less access to HIV services. Additionally, they do avoid seeking HIV screening and testing and HIV services because of this discrimination and stigma. And this ultimately leaves them vulnerable to HIV infection and transmission and doesn't really help the epidemic later on. So assessing the effectiveness of the current programs that Guatemala has implemented to help mitigate the epidemic in regards to PEPFAR and USAID HIV Care and Treatment Project. Ever since these two programs were implemented, current existing HIV clinics have been given more resources to help improve the quality of life of people living with HIV. HIV clinic and staff has been successfully trained to use risk criteria in HIV screening, and because of this, and they were able to provide support to health services, it has allowed about 11,000 people receive treatment. And since the implementation of both of these projects, the viral load of people in treatment has been 93% and 94% with viral suppression. In terms of the future strategies moving forward, I think the focus should be more on bridging the gaps in health disparities that exist in vulnerable populations. So collaborating with the Ministry of Health in Guatemala and the CDC to allocate resources and fundings would help mitigate the epidemic. But most importantly, having these resources and funding focus more on the vulnerable populations, such as sex workers, trans people, and men who have sex with men. Opening clinics specifically tailored to them would help encourage them to seek treatment and seek services in a location, in a place where they are free of judgment and free of stigma. which can help overall increase testing within these populations, but also not forgetting about the rural communities, providing easier access to HIV services, education, and treatment to them would also help mitigate the epidemic. And that is the end of my presentation. Thank you so much for listening.